Hello guys, hope you are all okay. Once again, I'm Dr. Nadeem Awan with ultrasound, X-rays, CT scan and radiological videos. Hope you're watching my videos and you are getting information from all these videos. And beside this, you're also passing on these information to your other colleagues as well. Today, I'm going to discuss about one of the particular abnormality that is called as Sinding Larsen Johnson's disease. Although the name is quite big, but the patients, quite often you will see these patients in your clinics if you're a GP, and in your clinic if you're a physiotherapist, and in ultrasound clinics as well, and if you are reporting a radiologist, so you will see all these Sinding Larsen Johnson's disease. What happens with this disease is it is again the disease of the patellar tendon. In the previous video I have discussed about the patellar tendon disease, which is distal patellar tendon disease, that's Osgood-Schlatter disease. So far Sinding Larsen Johnson's disease is concerned, it is also related to the patellar tendon, but it is proximal patellar tendon, which is attached with the inferior pole of the patella. So if it happens here, so you will think of this disease. So at the same time, the patient will come to the clinic with a complaint of swelling, pain in the anterior part or anterior inferior part of the knee joint. So you must pay attention and find out whether this is Osgood-Schlatter disease or this is Sinding Larsen Johnson's disease. So my GP colleagues, my physiotherapist colleagues, my ultrasound colleagues, and my radiological or radiology trainee colleagues will definitely benefit from this video. So what happens with the Sinding Larsen Johnson disease is this is actually tendinitis of the proximal insertion of the patellar tendon, which involves the inferior pole of the patella. If you are going to look for on the X-rays, so on the X-rays what happens would be the tendon would be enlarged. The second thing, there will be ossification, and the third thing is might be fragmentation of the inferior pole of the patella. So these three findings associated with the soft tissue swelling you can appreciate. If you're doing ultrasound, it's quite easy to pick. Those physiotherapist colleagues who are doing ultrasound in their clinics, and the patients start and the patient comes with a complaint of swelling of at the anterior inferior pole of the knee joint, so you must consider this disease, and you just put the probe on, and on the probe what the point with you will be able to appreciate. You can first find out that there is an inferior pole of the patella and the tendon would be attached with. Just take the measurement, the tendon would appear thickened, the tendon would appear hypoechoic, and the second thing, there will be calcification, there will be ossification process going on. So this is quite easy diagnosis to pick on the ultrasound imaging. If you find that that there is no availability of the ultrasound in your clinic, what you are going to do is you must advise again a knee joint AP lateral view. So a knee joint AP lateral view, when the radiologist will report, so you will find whether this is Osgood-Schlatter disease. But actually Osgood-Schlatter is quite easy to pick, that it is at the distal and it is on the tibial tuberosity. So far the Sinding Larsen Johnson disease is concerned, it is at the inferior pole of the patellar tendon, which is again a specific area, so you won't miss it. So these are all the points which you can easily pick on the X-rays, on the CT scan, on the MRI, and how will we will see on these images. Let's start watching these images, and don't forget to advise the patient simple X-ray AP lateral view with the advice that you are interested to look for Sinding Larsen Johnson disease, or you advise the ultrasonography, particularly ultrasound of the knee joint, anterior inferior pole of the knee joint for the Sinding Larsen Johnson disease. So you just advise these things and you will be able to get the results. And then so far the management is concerned, you know better because that is your field, and you know very well about that. So let's start watching these images. This is the radiograph for the Sinding Larsen Johnson's disease, and here you can appreciate that the traction tendinitis at inferior pole of the patella can be seen, indicated by the white arrow. This is the inferior pole of the patella, and here you can appreciate that the tendon of the patellar tendon, which is attached at the inferior pole of the patella, is slightly having an inflammatory process with the calcification and ossification. This can be seen on this radiograph. This is another image showing both MR images and the plain radiograph. Just focus on the patellar tendon and patellar inferior angle. On the MR, it is clearly showing that there is a change of intensity. It's a hyper intense because of inflammatory process of the inferior pole, and on this plain radiograph the inferior angle of the patella can also be seen clearly. So this is Sinding Larsen Johnson's disease. Ultrasound can be a very useful tool here, indicated by these white arrow. This is patella and the inferior angle of the patella showing slightly fragmented, small detached fragments of the bone, and where the patellar tendon attaches. So this is the patellar tendon clearly depicting on the another image. So this is a clear pattern of the disease, where you can see the ossification, where you can see the change in the thickening of the patella at the point of insertion at proximal end. So the ultrasound is very informative, and it will gives you a clear detail of the tendinitis. Another ultrasound view where you need to have a high resolution probe, and you have to apply a lot of gel on, and without any compression just put the probe on the angle where the inferior patellar margin is, and where the inferior at the inferior patellar margin where the patellar tendon attaches. This is quite easy and convenient those who are doing physiotherapy. If you have the equipment with you, you can straight away confirm this Sinding Larsen Johnson disease in your clinic, and also Osgood-Schlatter disease, because the findings are only the changes in the patellar tendon's fibrillar pattern. There will be ossification, and there will be also fragmentation of the bones where the tendon attaches. Here in this image you can also appreciate all these findings. Look for the patellar tendon where the patella is inserting at the inferior pole of the patella. There is a change in the echogenicity. Beside this, there is small fragmented particles can be seen. So this is what the Sinding Larsen Johnson's on the ultrasound image. So plain radiograph, MR and ultrasound is useful for this.